four cardiologists here. We each have a separate interest, and so we virtually all of the common specialties in cardiology. Apart from cardiac surgery, we can virtually do everything else now in-house here.
Bond's is a very comprehensive cardiology unit, from chest pain assessment. We've got a fantastic echo lab, stress testing, Holters and blood pressure monitors, high throughput.
We have a very good cardiac department. We have very good technicians, very good nurses. We can provide pretty immediate access to care for any procedure or any diagnostic test that the patient requires.
We do ECGs, we do blood pressure monitors, Holter monitors, then stress testing and echocardiograms. We also have the Rapid Access Chest Pain Clinic, comes under my wing. Now that is for chest pain, or if the GP thinks you need urgent attention fast and efficiently, we provide it.
I've worked here for over 30 years. I see great changes. Prior to this, people used to come in and just sit up in the coronary care, be treated chemically with drugs. Now they can come in, it's rapid access, come into the chest pain clinic, and within an hour they can be over into the lab and have a stent inserted.
You've got a number of options in terms of medical therapies, but you also have the opportunity to step in and do something almost surgical, where you can find somebody in extreme distress, open up a blood vessel with a stent or something like that, and get a result within minutes. I recall one patient in particular, GP rang, patient was not feeling well with chest pain. He drove him up to the chest pain clinic. We did the ECG, he was having a heart attack. Brought him straight down to the lab, did the angiogram where we looked to see if there's any blockages, saw one blood vessel was blocked, opened it up, put a stent in, and he went home the next day. So that was quite gratifying.
Well, I've always been interested in cardiology and something to do with the heart. I quite used to like mathematics and physics in the past, and this is the perfect combination for me. So that's why I ended up being a cardiac electrophysiologist. Basically, we are nerds. And we deal mainly with heart rhythm abnormalities, with patients whose heart is not pumping very well, so patients with heart failure, and also screening for families with the unfortunate condition of sudden cardiac death. And this applies predominantly to people with an abnormal heart rhythm. Now, some people feel very well in atrial fibrillation, and all they need is medication, but some people are very, very symptomatic. Now, for these people, ablation procedure can be performed in that we take these catheters, we put them in the groin, so it's done under local anesthetic with a bit of sedation. They go all the way to the heart, and we burn around certain areas of the heart with a view to eliminating these conditions. For people with heart failure, 10 or 15 years ago, the prognosis was worse than cancer, but things have changed dramatically over time. And now we have all sorts of devices that we know that can be used, and these are called pacemakers or ICDs. So these things are done as a day case procedure. So people come in, they have the procedure, they go home the same day or the next day. There's some tiny risks attached, but overall the benefits are so high. So the American Heart Association and the American College of Cardiology and the European Heart Society have all endorsed these kind of devices in selected patients. So this is why these people need to be seen by specialists who deal with these things to decide whether they need it and when do they need it.
After a cardiac event, you're petrified. You've had something seriously life-threatening.
We expect everybody to get back to life as normal after having had their event and completed a cardiac rehab program. That's the idea of doing cardiac rehab, getting back to life as normal. I suppose when we see them coming into cardiac rehab, lots of them are nervous and they're not really sure if they really want to do it. And then when they've completed the 6-week program, the change, there's such a massive change in them. It's amazing, to be honest.
What you get out of cardiac rehab and what you get out of our job is what you put into it. And it is extremely rewarding. We give all the patients 110%. We do, yeah.
I think we have a great team here. We have a great team of cardiologists. We have a wonderful lab. We have a wonderful cardiology department.
We depend on a wide team of people from the front door to the back door. It is a truly multidisciplinary thing, and I think that's what allows people to feel comfortable, because they're not really isolated and they can always ask for help.
It has to be a team effort from the minute the patient walks through the front door of the hospital. It's a pleasure to work in such an environment, so everybody does work as a team, but it's a good team.
Yeah.
The best part of the job is seeing patients who are unwell, who come in and then who are much better with all the intervention and treatment. And when we know that we have actually made a difference to people's lives.
I still like the contact with patients, seeing patients, having patients coming in, and often by giving them the appropriate drugs, we can get them better.
You'd find it hard to find a better place to work than the Secours Hospital in Cork. You can get things done. If it makes sense from a patient point of view, from a business point of view, it'll be done. I mean, we can get patients into the hospital, we can treat them, and we can get them home. The hospital seems to be designed to try and facilitate that type of delivery of care. The technologies that we have at our disposal, and because of the facilities here in the Bonds, the interaction generally goes well, and that's very gratifying.